For 5 minutes for an opening statement. Thank you, Mr. Secretary, for being here before us today, and we are here to examine the fiscal year 2025 budget request for the U.S. Department of Health and Human Services. Just last week, the monthly inflation data showed that year-over-year inflation was 3.5% in March. Instead of including policies to help everyday Americans, the HHS budget request doubles down on the tax and spend policies that have cut American paychecks. The budget request totals nearly $1.85 trillion and over $100 billion increase over last year's request. Today we'll hear the Secretary talk why the budget. We need to ask the Secretary to talk about why the budget doesn't lower health care costs, but it spends trillion in new dollars. This misses the mark. The budget does little to address the cost of care for the average family of four, with employer-sponsored insurance paid almost $24,000 in annual premiums in 2023, which represents a 22% increase in the average annual premium a family paid in 2018. Just because someone has health insurance doesn't mean they can afford health care. Further, the Kaiser Family Foundation changes made by the misnamed Inflation Reduction Act will lead to substantially higher premiums for seniors enrolled in a Medicare Part D drug plan next year. This year, seniors are paying an average of 21% more in Part D premiums, with seniors in the 5 states seeing the highest levels of Part D use projected to pay upwards of 57% more in monthly premiums, and this includes California. Those states are likely to skyrocket even higher in 2025. Evidence suggests that these price controls are also leading to less research and development in critical research areas, undermining patient access to life-saving therapies. Instead of working with House Republicans to find a way to ensure working-class families can access the care they need at a price they can afford, the administration's budget doubles down on more handouts for wealthy by permanently expanding ACA insurance company studies and price controls, which would be paid for by raising taxes. Additionally, this budget requests further previous actions from the administration to impose burdensome and unnecessary oversight over nursing facilities and long-term care providers. While I agree we ought to do as much as possible as we can to protect patient safety, this top-down approach will only place more strain on an already overrun part of our healthcare sector and reduce access to care for vulnerable patients. These new proposals come on top of pending regulations that would establish minimum staffing standards for long-term care facilities, costing Kentucky long-term care facilities $69 million annually just to compete. Regulations like these are being considered despite more than 500 nursing home closures across the country since 2020, as well as the industry significantly experiencing unprecedented workforce shortages. I'm disappointed the budget request has nothing to address the influx of illicit drugs like fentanyl coming across our border at a rapid rate. In fact, the budget only mentions fentanyl once in a footnote, despite Customs and Border Protection seizing nearly 10,000 pounds of deadly fentanyl at our southwest border in the first 6 months of fiscal year 2024. We have policy that have passed out of this very committee that I'm disappointed were not included in this year's budget request, such as the Halt Fentanyl Act and Securing Border for Public Health Act. Both of these bills would give law enforcement, including our brave Border Patrol agents, with tools to crack down on drug traffickers and keep these drugs off our streets. I am glad to see that the $6 million request for Comprehensive Opioid Recovery Centers program, which I led in establishing in 2018. These recovery centers provide wraparound services for individuals seeking help to overcome substance use disorder. This was also included in the Support Act reauthorization, which just passed the House, with a broad bipartisan vote. I look forward to working with the Senate to get Support Act signed into law. In closing, I believe it's time for common sense solutions to solve some of the most serious programs affecting American patients, especially the high cost of health care. I urge the Biden administration to work with Congress to find bipartisan policies that can truly lower the cost of care, eliminate ineffective programming, reduce federal spending, and provide more choices for American patients by incentivizing, not stifling innovation. Thank you. I will yield back and recognize the ranking member of